Childbirth. Childbirth is a joyous, exciting moment to welcome a baby into the world. As beautiful as giving birth is, there is no conversation about the side effects of childbirth. As Judith A. Lothan states in Why Natural Childbirth, in a very real sense, the pain of each contraction becomes a guide for the laboring woman. You've heard all about the excitement and joy it is to bring your baby into the world. Today I want to tell you about natural, epidural, and finally cesarean childbirth and the effects giving birth has on the body. There are no side effects to the natural childbirth. According to Why Natural Childbirth, it's important to understand that the pain of each contraction are valuable in labor. It is a way to help the mother facilitate birth. The pain of the contractions is a guide to help the body give birth to the baby. Being surrounded by family and friends is key to giving birth naturally. The mother rests in between contractions. When the baby is delivered, labor slows down and the body becomes less efficient. Flexibility is required when deciding to go with a natural childbirth. But natural birth is different for everyone. When a mother chooses natural childbirth, could be because she's one in a few who loves a challenge. Some mothers choose natural childbirth because they want to avoid any side effects that could cause harm to them and their babies. According to babycenter.com, a few benefits from natural childbirth are feeling empowered, no loss of sensation, and is still alert to surroundings. And natural birthing techniques aren't invasive and doesn't cause harm to the mother and the baby. So we've talked about natural childbirth. Let's discuss epidural. What is an epidural? According to an article called Pregnancy and Birth, Epidural and Painkillers for Labor and Pain Relief. An epidural is a way to deliver an anesthetic that the pain signals travel from the spine to the brain, involving an injection of a small amount of anesthesia into the epidural space of the spine. The epidural space is filled with fluids and surrounded by the spinal cord. Nerves that carry pain signals from the body to the brain connected to the spinal cord in a certain place. In a few cases, epidurals can't be given to women who are allergic to anesthetics or have blood clot problems. The epidural does not last the entire labor. So according to an article called Pregnancy and Birth, Epidural and Painkillers for Pain Relief, a catheter is usually put in the woman's back, which is a thin plastic tube pushed forward into the epidural space using a special needle that is injecting more anesthesia and painkillers as needed. This is controlled by the doctor in most cases, but sometimes there is a patient control pump. This means that the patient can give themselves more medication if needed. If you're wondering if there could be risks or side effects to epidural, there are, according to an article called Epidural, Benefits and Side Effects of Anesthetics During Labor. Epidural is very safe. Serious complications are extremely rare. However, with medication and medical procedures, there is the potential of side effects. Some side effects is decreasing blood pressure. This means the medication may lower your blood pressure, which slows your baby's heart rate. To make this less likely, the patient will be given extra fluids through the tube. Sore back is another side effect of because whereas the needle is placed can cause soreness, and the soreness does not last for more than a few days. Another side effect is headaches, which happens on a rare occasion, but in a rare case, which can cause headaches, may last for a few days if left untreated. If this situation arises, discuss treatment options with the anesthesiologist. I know if you're wondering how the epidural affects the baby. The epidural does not affect the baby because the baby gets a very small amount. There is no evidence that it caused harm. According to the article, ever do a benefit and side effects of anesthesia during labor. I know a few may be wondering if you'll be able to stand or walk after giving birth with the epidural. According to Pregnancy and Birth, Epidural and Painkillers from Labor and Pain Relief, during the first phase, the dose of epidural is a low dose, so the woman could move and walk in the first phase of the labor. During the second phase of labor, when the babies and women is sometimes advised to sit up, and for instance, to adjust the head of the bed or lean on your partner. It is best to choose the best position that is most comfortable for the patient. So we've talked about natural and epidural childbirth. Let's start the conversation on cesarean childbirth. A cesarean childbirth is a surgical incision made in the abdomen and uterus, according to the Mayo Clinic. A planned cesarean is necessary if there are certain pregnancy complications. The need for a cesarean can be many different reasons. According to the Mayo Clinic, a few reasons would be labor isn't progressing normally, which means the first stage of labor, the opening of the cervix, and the most common reason for a cesarean. Another reason is the baby could be in distress, which means the baby's heart rate might have changed. A few more reasons would be carrying more than one child, there's a problem with the placenta, and the babies are in an unusual position. Some women request a cesarean for their first pregnancy to avoid any possible labor complications from vaginal. According to the College of Obstetrician and Gynecologists, this might not be a good option for women who plan to have several children. The more cesareans a woman has, the greater risk of problems with future pregnancies. According to the Mayo Clinic, like any other major surgery, a cesarean surgery includes risks. A few risks include breathing problems. A baby delivered by cesarean is more than likely to develop breathing issues, causing them to breathe too fast for a few days. Another risk is surgical injury. Although rare, accidental nicks to the baby's skin can occur during surgery. Another risk is infection of cesarean, and this might be a risk of developing infection in the lining of the uterus, in the urinary tract, or the incision site. Another risk is a reaction to the anesthetics, and another risk is blood clots, as a cesarean might increase the risk of developing blood clots in a deep vein, especially in the legs or the pelvis. If a blood clot travels to the lungs and blocks the blood flow, that could be damaging. That could damage and can be life-threatening. Another risk is the baby could be in distress, which means the baby heart rate change, making the C-section a safer option. Another problem with the placenta previa, and a condition in which the placenta becomes attached to the wall of the uterus. A cesarean also increases the risk of the uterus tearing along the scar line for women attempting a vaginal delivery in a later pregnancy. According to the Mayo Clinic, a healthcare provider might recommend blood tests before a cesarean. These tests provide information on blood type and the level of the main component in the red blood called the hemoglobin. This is the results. Can be helpful in the case you need a blood transfusion during a cesarean. The care after a natural childbirth is easy because you get up and move around more than likely, from my personal experience with giving birth to my children naturally. Outside of waiting the 6 weeks, you can do the day-to-day activities from showering, eating, taking care of your baby. With the epidural, the care after an epidural is the same as natural. The only difference is needing assistance when the mother is in the hospital to move around after just giving birth. A cesarean recovery may be discomforting, and fatigue are common to promote healing. Take it easy when possible. Try to keep everything that you and your baby need in close reach for the next few weeks. Do not lift more than 25 pounds. Use recommended heat pads and pain medication that are safe for breastfeeding. Recommend your healthcare provider including ibuprofen, Advil, and Motrin, etc. Wait to have sex to prevent infection. Wait at least 6 weeks to have sex, and do not put anything in your vagina after you've had a cesarean. Wait to drive if you are taking narcotics for pain relief. It may take 1 or 2 weeks before you can fully apply the brakes and twist and check the blind spots, according to the Mayo Clinic. Evidence shows from the Mayo Clinic in the case of an infection in the incision site of the cesarean Pay attention to the symptoms. Contact your healthcare provider if worsened. If you are red, swollen, and leaking discharge, if you have a fever, have heavy bleeding, or you have worsened if your moods, loss of appetite, over fatigue, lack of joy, ensure after the child is born, most have postpartum depression. Postpartum depression. According to the American College of Obstetrician and Gynecology, recommends for postpartum care is ongoing to contact your healthcare provider within 3 weeks after delivering, 12 weeks within 3 weeks after delivery. Within 12 weeks after delivery, you should see a healthcare provider about postpartum evaluation during this appointment. Your healthcare provider will likely check your mood, especially discussing contraceptive. Review information about infant care and feeding and talking infant care about your sleep having issues related to fatigue. A physical exam, including a pap smear, if it's due. This might include a check of the abdomen, vaginal, cervix, and uterus to make sure you're healing well. To conclude, I would like to thank you for giving me the opportunity to discuss the effects of childbirth. With the variety of different effects of each way to give birth, from natural to cesarean, can vary for different people. In this speech, I hope to help people understand the medical attention needed for women when giving birth and the risks of the birthing plan being chosen. So, when you decide your birthing plan, think of the effects that can cause that can occur with your choice of birthing plan.